All right, welcome. Okay, so today is November 17th, 2022. So if you're watching a recording of this, some of the information might be out of date. So be sure to go to cdc.gov or whyimmunize.org for the most up-to-date information, especially about any vaccine preventable disease outbreaks or pandemics that we are going through. So we recently learned about a really neat new project out of University of Arizona and Kent State, which is a university in Ohio. And it's called the Global Vaccine Poem. And would love if anybody has heard of this, if you can like chat in how you've interacted with this project. It's a really neat way that the humanities department and poetry departments at both those schools have kind of helped provide a space for people all over the world to process emotions and express emotions about the pandemic, both about the lockdown phase and then also just the hope that the vaccine gave us and continues to give us, especially as we prepare to be with our families, many of us for the first time since the pandemic started, for Thanksgiving. And we are also celebrating Native American Heritage Month. And because we wanted to celebrate both of those things, and we also wanted to let you know about the project, I am going, let me do this. We're going to spend just a minute seeing one of the poems from Ophelia Zapeta, who is a member of the Tohono O'odham Nation and is a PhD and poet down in Southern Arizona.
Dear vaccine, Kuran, Shapa Masma, Yatamna, Yamnoi Buppa. We meet you and shake your hand in greeting. It has been some time since we shook anyone's hand. Sapachtat Amne, we are happy to see you. Hakyai Amjad Amanyanda. We have been waiting for your arrival for some time. Your journey is done. You will now rest in our bodies. Like other healers before you, you will be there when we need you. The tale of your journey will be held in our collective stories. It will be retold next year when we acknowledge the death anniversaries of our relatives and friends and all those who tried to fight the enemy alone. We will tell of the battles you fought on your journey, the battles against non-believers and conspiracy theorists. You will be known as a hero, a slayer of enemies, and like so many others before you, you will be known by many names.
We really appreciate everything that you're doing as we continue through this pandemic. We're thankful for you, and I hope that there are moments. We know your offices suck right now, right? Like you have so much respiratory stuff, you have flu, you're still continuing to be on the front lines of the pandemic. And we hope that you find time over the next few months to just kind of pause and remember that you're part of saving a lot of lives. And this vaccine for the COVID pandemic, for flu shots, for MMR, your Tdap vaccines, all of those save a lot of lives. They give us a lot of hope. And none of it would happen if it weren't for you. And I think that this is just one way to be able to express healing around the pandemic. And I think somebody, if we haven't already, can put a link, or I can put a link into this. This project is ongoing. If you go to the website and you kind of scroll to the bottom here, there's this part that says share your voice. And if you click on that, you read the poem by the young poet not baccalaureate, what Alari, I don't remember how what the right word is, but by Naomi Shahib Nye. And then you can also contribute to the poem, which is a really just kind of a neat thing and a gift that Kent State and University of Arizona are giving us. So I hope that Dr. Staub is still on. I'm going to transition over to you. Now I see your smiling face. He is here to give us a little bit of an update about all of the pandemics and outbreaks and everything that we're living through right now. So
Rebecca, can I share a screen?
yeah, go for it. Do you have permissions?
Yeah.
I think so. Okay. All right, here we go. All right, so just briefly, thanks, Rebecca. That was a nice way to introduce things. We, like Rebecca said, I acknowledge that all of you are in the midst of what I'm about to report and share. And so thank you for all that. Here in public health, let's see, this was on November 3rd, so 2 weeks ago, sent out a serve alert to all providers who receive our enhanced surveillance alerts about the rise of respiratory viruses out in our community. So RSV, certainly 2 weeks ago, and still is having a significant impact on our pediatric population and healthcare, providing services to pediatric populations. Flu is on the rise, and so is COVID. So we just really wanted to make sure that everyone is aware that all three of those things were on the rise going into our holiday season. And just remembering that our basic control methods for all of those are the same. So as much as we were happy to get rid of a lot of COVID precautions, we really need to remember that they work for all viral respiratory conditions. So looking at the data, again, this is national COVID data. So you can see nationally at the very end of that epi curve, we're just starting to see an uptick. But here in Maricopa County, again, this is the last 60 days, we've been riding a relatively low kind of plateau in cases. So this looks, I think, a little scarier than it really is. But we have seen this over the last couple of years. We've seen around this time an increase in COVID cases. And so believe we will continue to see this as COVID kind of falls into its regular annual pattern, that we see an increase this time of year, which again is not surprising given what we know about other respiratory illnesses. But COVID is definitely on the rise. This is flu. So regionally, we are currently in a regional status, and you can see there. Again, the dashed line is our five-year average, and the blue line or the blue bar is our current year reported cases. So we are far above where we usually are. As I have been talking to people, we look to the Southern Hemisphere to kind of try and predict what we might see. And in Australia, they had an early and a very high flu season. So that is what we are seeing. So far, the news we're getting is that the flu A that is spreading is well matched to our vaccine. So again, we should all use that in our attempts to encourage flu vaccination and encourage it now. Cases are on the rise. And then RSV has just really just had an amazing comeback after 2 years of relatively being quiet. We're just seeing a lot of RSV cases. So certainly in my clinical practice at Phoenix Children's, we're really kind of swamped is a good way of saying it. So these three illnesses rising together give us in public health certainly pause as we consider where our healthcare systems are and what our healthcare capacity is going into the rest of this respiratory season. All of you know that the greatest limitation in our healthcare systems right now is not beds and space. It is healthcare personnel. We are really, again, working with all of you to try and encourage COVID and flu vaccination in the general population, as well as in that healthcare personnel population, because we need everyone on board this season and able to work and staying healthy. So obviously lots of good stuff out there. The last thing I will just mention, because it's what I'm spending the rest of my day doing, is we are in the midst of our fourth activation here in public health. We recently announced a case of dengue here in Maricopa County in an individual who did not have travel history. So again, most of our dengue cases here have recently traveled to an endemic area, and we chalk up their infection to that exposure. But this case did not have travel history, and we were able to go back and work with our folks at County Environmental Services. They tested the mosquitoes around the same time that this individual would have been exposed here locally, and we were able to find a positive mosquito pool for dengue. This is the first time that a mosquito pool here in Maricopa County has tested positive for dengue ever. So we are doing a survey in and around the area where this case lives, as well as where the mosquito pool was found, and asking people to participate in testing to see if there's more evidence of dengue here in Maricopa County. We're also working with environmental services to do a more broader survey of all those mosquito pools going back in time and forward to see if we detect more dengue. The other big push has been to do provider education and make sure the providers here in Maricopa County are thinking of dengue when they have sick people present to them. So we'll probably have more information on that as this response goes, but things are always exciting here in public health. Thanks to Tappy for inviting us here. I will probably, if there are no questions after this, log off, but I'm happy to take any questions and I'll stop sharing.
So does anybody have questions for Dr. Staub on COVID, flu, dengue, monkeypox, whatever other fun diseases you have questions about?
And sorry, thanks for reminding me, Rebecca. Our monkeypox activity continues. We continue to reach out into the community to provide vaccine, as well as trying to get those who got a first dose of vaccine their second dose. But cases in general have been much lower, and we're excited for that.
All right. Well, I guess you're not popular today.
That's okay. That's okay.
But thanks so much for joining us, giving us an update. And just like you said, they know all this because they're seeing them in their office. Well, hopefully not too much dengue or monkeypox. But
let me know if you're
flu,
seeing that in your office. Yeah.
But COVID, flu, and RSV for sure. So, but thanks for logging on. And we have a special guest today, Roseanne Beans from ADHS. Our topic today is going to be the VFC program guidelines. So Roseanne, and Marcelina from ADHS is also on. So, and if you want to share your screen, Roseanne, and introduce yourself, you can just take it away. And for all of you, if you have questions, go ahead and use the chat box or raise your hand or unmute yourself. Let us know if you have a question. We have plenty of time for questions about VFC program guidelines.
Thank you for the introduction. Hello, everyone. My name is Roseanne Beans, and I'm the lead IPS, which is Immunization Program Specialist at APO, Arizona Immunization Program Office. I am going to share my screen. And can you see my slides?
Yes, we do.
Awesome. Thank you so very much. All right, everyone. Welcome to the Vaccines for Children Program Guidelines Training with the Arizona Immunization Program Office. And the number you see in bold there in black is our ASIIS hotline. So if you have any questions, concerns, regards, just reach out to us. The Arizona Vaccine for Children Program Operations Guide is found on the azdhs.gov/VFC. We highly recommend for providers to refer to the operations guide as often as it has written in details about our policies and procedures for the VSC program. The Vaccine Accountability and Management Plan must be updated annually and whenever there is a change in key VFC staff. The VAMP, which is acronyms for the Vaccine Accountability Management Plan, must be placed on the unit where VFC vaccines are stored. On the Arizona Immunization Program website, you will find the link to the operations guide, required forms, incident report, resources, and job aids. As a reminder, our website is azdhs.gov/VFC. I always tell my providers to favorite the operations guide and not print it because it's continuously changing and updating. So just make sure you favorite on your favorites so you can always refer back to it. Annual training is required for the primary and backup coordinators. The two trainings that we have are the APO train, which is guided more towards Arizona rules and requirements, and the CDC You Call a Shot is more towards federal guidelines. The difference between the certificates are the CDC is good for calendar year. So for example, if you took the CDC You Call a Shot today, it would expire on 1/1/2023. So that's why we encourage our providers to take the APO train, because not only is it good for 365 days, it follows the Arizona rules and requirements. But if you do decide to take the CDC You Call the Shots, please complete either the Vaccine for Children's module or the Vaccine Storage and Handling module. That will meet the training requirements. The submission of the provider profile change form is a requirement and must be submitted when there is a change of VFC coordinators, office manager, a new signatory physician, and or you need to remove or add additional web users. ASIIS stands for Arizona State Immunization Information System. The immunization registry is designed to capture immunization data. On the homepage, you will see the buttons to access the provider profile change e-form, the incident report, and the new feature, which is chat now. And you can always reach out to report any login issues or any questions that you might have. So the overall theme for the rest of the training will be to protect the VFC vaccines so you can protect your kiddos or patients. So the approved vaccine storage units are the use of a standalone unit, which is one refrigerator and one freezer. Providers that were onboarded in the past with a household dual control unit has been grandfathered in, ensuring that the control is one for the refrigerator and one for the freezer. Now with the new CDC requirements, if a provider will onboard today or tomorrow, if they have a household unit, they can only use the refrigerated portion of the household unit. And you have to make sure again that you have those controlled, one for the fridge and one for the freezer. And to store frozen vaccines, the provider is responsible to purchasing a standalone freezer. If your site wants to purchase new units, contact the APO office for guidance or refer to our operations guide for unit requirements. Ensure that you have enough space in your unit for flu, back to school, and now COVID. So ensure that your unit does have enough room to store all those vaccines. Dorm-style refrigerators, those with a freezer inside, as seen on this picture, are never to be used under any circumstances. For safety reasons, we strongly encourage only one unit to be plugged into an outlet. Providers must not plug VFC vaccine containing units into surge protectors as they can be easily switched off. Plugged into an outlet that is controlled by a switch as they can also be easily switched off, or in outlets that have a reset button, as this can also be manipulated, which can result in vaccine wastage. Providers are required to have the do not unplug sign on the wall next to the outlets that a VFC vaccine containing unit is plugged into. Providers are also required to have the circuit breaker sign on the circuit breaker with the number of the circuit breaker that corresponds to the number on the outlet that the unit is plugged into. The circuit breaker label must have an emergency contact name and number. Proper vaccine storage temperatures for the refrigerator must be between 36 Fahrenheit to 46 Fahrenheit, which is 2 to 8 Celsius. For the freezer, it's negative 58 Fahrenheit to 5 Fahrenheit, which is negative 50 to negative 15 Celsius. Ideally, providers want to keep the refrigerator at 40 Fahrenheit, which is approximately 4.4 Celsius. And in the freezer, ideally at 0 Fahrenheit, which is approximately negative 17.8 Celsius. If the refrigerated vaccines reach 32 Fahrenheit, which is 0 Celsius, or lower, your site will be asked to waste the vaccines as they are no longer viable as they have frozen. Organizing and storing your vaccines in the storage unit. The VFC vaccines must be in the middle shelf. VFC vaccines cannot be on the top shelf, bottom shelf, indoors, or vegetable crispers. Water bottles are required to be in the refrigerator and freezer. On the top and bottom shelves, the do not unplug sticker on the wall next to the outlet. The data logger must be placed on the outside of the unit to avoid opening and closing the unit door to take the temperatures or to see the current temperatures. The glycol bottle must be on a middle shelf with the VFC vaccines to ensure the data logger is recording the temperatures surrounding the VFC vaccines.
Roseanne,
Yeah.
Oh, sorry for that. If you go back to that picture.
Yeah.
Sorry, does it matter if the privates were, as long as it's not on the bottom shelf or the top shelf? If there's 4 shelves, could privates be where the VFC is on this photo and VFC where the privates are?
Actually, no. So if you have, let's say, a unit with 4 shelves, the VFC must be like in the middle too, and then you can have private on the bottom and on the top. We just don't want the VFC on the top because of the vent, and it could cause the vaccines to freeze. So
Wouldn't we not want any vaccine on the top or the bottom then? Doesn't matter
yes,
if it's
we would not. It is highly recommended, but because the private stock is per the provider, and if they choose to have them on the bottom or top shelf, that's up to them. But usually with big practices, when they have those really nice big units, it's nice because they have those 2 shelves for VFC and the rest are for private and nothing's touching on top or bottom.
Yeah, and I think it would be for best practice would be for no one to put any vaccine on the top shelf or the bottom shelf, because we want to protect all vaccine, not just VFC vaccine, right?
Exactly.
So, yeah, so that would definitely be best practice. And then Jen is asking, what if the vent is in the back?
So in the back, like shown on this picture, or?
Yeah, what do you mean, Jen Nunez?
So if the vent cools down the back of the unit, not from the top of the unit.
Oh, well, that's why you put the water bottles in the back, because it buffers it from the air coming out. Does that make sense?
Yeah, so does that matter if the vaccines are on the top?
Oh, I see what you're saying. Unfortunately, they have to be in the middle shelves.
Okay.
Yes, ma'am. Any other questions? All right, we'll go ahead and continue. Data loggers are required for all cold storage units storing VFC vaccines. If your data logger has a configurable alarm, these are the temperature ranges it should be set, which is 36 to 46 for the refrigerator. And for the freezer, alarm should be set at -40 to 5 Fahrenheit. portable data logger is also required as a backup and must be kept on site. Data loggers is required to record the temperature every 15 minutes, and data loggers must be downloaded twice a month and emailed monthly to Arizona VFC at azdhs.gov. And we spell out Arizona. The calibration certificates must contain the model number, serial number, calibration date, and calibration expiration date, that the device is in tolerance or pass, and the statement that the device conforms to ISO 17025 or is traceable to the standards maintained by NIST. A valid, non-expired certificate of calibration is required for all data loggers used to monitor VFC vaccines, including the backup. Providers are required to recalibrate data loggers before the calibration certificate expires.
And did you say how often it needs to be emailed?
Yes, so it is a requirement to download your data loggers twice a month and then emailed monthly.
Okay.
Yeah, so when you dock your data loggers and you save it onto your shared drive, you can either email it at that time if you wish, that's up to your preference. I highly recommend it to my providers, that way they don't forget. So every 2 weeks they dock it and download it and send it to the Arizona VFC. But I know some providers will save it until the end of the month because they place monthly orders or whatever the situation is, but it is required for us to get the data loggers on a monthly basis, whether you're placing an order or not.
Great.
And Roseanne, actually, that was my question too, because in the past you had to have a data logger report with each new order, even if you had already sent it like at the first of the month, and now you do an order on the 20th. Do you need to send it again?
Yes. So like Jennifer said, if you did place an order today on the 17th and then again on the 20th, you will need up-to-date data logger reports.
So every time an order is placed, but at least monthly.
Yes, ma'am.
Okay. So some of you are ordering constantly, but for, some people don't order as much VFC vaccine. They don't have as many kids.
Yeah, especially for those big practices, they have this packed down, so they know, I'm going to download it on the 1st and 15th and then send it on the monthly basis, or they're probably ordering every 2 weeks. So it works for them to download it and send it to us.
And is it the last 3 months of temp log?
No, each time they play. What do you mean? I'm sorry.
So Lorena's asking last 3 month temp log with every order, right?
Well, no, because if they're sending it on a monthly basis, we have it up to date. So I think she's referring to when we go out for compliance visit, we look at data logger reports and temp logs. So she might be confusing them. But if you want to throw yourself off mute, I'll be more than happy to answer that question. Oh, okay. So yeah, for compliance visits, it is different than when you place an order. I hope I'm answering that question correctly. In addition to the data loggers, providers are still required to document their temperatures on the temperature logs. You are required to record the temperatures twice daily, once in the morning and once in the afternoon. Providers are required to document the min and max from the previous day. And this has to be done for both refrigerator and freezer. So you want to make sure you record the exact time, the exact temperature to the 10th place. Circle, or you can circle Fahrenheit or Celsius, or you can highlight Fahrenheit or Celsius all the way down with a highlighter other than yellow. So you may do that. And then the min and max you will record just once in the morning for the previous day, and then make sure you put your initials. Temperature excursions must be reported to APO office immediately. You have the option of either an e-form or PDF document, or the option to contact the manufacturers directly for the viability of the vaccines and report it back to APO. The first one, you're probably familiar with this, but if you would like APO to process the temperature excursion, you are required to send a incident report by either our Google Docs or through a fillable PDF. Just remember, if your site experiences an incident, you must isolate the vaccines in the cold storage unit and mark them do not use. And we emphasize anytime you have a temperature excursion, you must report it to APO immediately. Our second option is that the provider can contact the manufacturer directly. If you choose to contact the manufacturer, please refer to the temperature incident instructions, which you'll see right here on my upper right side. Make sure you follow the directions, and it will lead you to a red cap link to upload the manufacturer stability of vaccine letters and data logger reports. If the manufacturer tells you, actually they'll email you a letter of stability, you may resume using the vaccines, but you do have to upload all that to the VFC program. So that is a new option that you can take if you like. So next will be screening for VFC eligibility, which needs to be recorded at every visit. You want to make sure you document the visit date, the eligibility. There are two categories. The first one is the child can receive VFC up to the day of their 19th birthday. The second category is access, American Indian or Alaska Native, uninsured, which means no insurance, and underinsured, which it doesn't cover any or all ASIIS recommended vaccines, or if the patient or does cover ASIIS recommended vaccines, but it has a fixed dollar limit or cap for the vaccines. For those situations, you will refer the child to an FQHC or RHC or a deputized provider, which we do have a list of them on our VFC website. Billing and administration fees. Patients should never be billed for the cost of the VFC vaccine. An administration fee not to exceed the $21.33 per injection may be charged to ASIIS or the patient or parent. If the patient is enrolled in ASIIS, providers may not bill the patient. Never turn a patient away due to an inability to pay. If a parent or patient cannot afford the administration fee, it must be waived. Sending parents or patients bills or sending parents and patients to collections is prohibited.
Roseanne, can we go back to the different ways to notifications if there's an excursion? There's a couple questions. So one is, so just to confirm, you do need to notify IPO of an excursion, either option?
Correct. Yes.
Okay. So no matter what, you're notifying IPO, it's just that you can get your guidance from the manufacturer directly now. This is a new change, like in the last, feels like the last few months.
Yeah, it's actually, it was implemented, I think, over the summer. So it's just easier for the provider. They don't have to wait on us. They can just contact the manufacturer directly.
But either way, you do have to notify IPO. And then the next question was, what if the excursion happens after hours?
You still have to notify us, but a lot of the manufacturers are back east. So just make sure you isolate the vaccines in the unit. And when you come in the morning, right away, submit or you can call the manufacturers and find out if the vaccines are viable. And the provider also needs to count how, like if the incident was from 5 o'clock to 6 o'clock, you have to count the intervals of that 15 minutes because you do have to report that to the manufacturer. Will let us know, oh, it was out of range for a total of 1 hour or 1 hour and 15. That's the information they need. So you do have to make sure you count the intervals of how long it was out of range and when it returned back to in range temps.
Okay. And then there's kind of a longer one from Talia. Talia, I don't know if you want to just unmute yourself. If you're able
Hi,
to.
can you guys hear me?
Yeah, we hear you.
So I was told we have AccuVax machines and they're approved for VFC. They you dispense them, load them in individually with syringes, and then they dispense them to you. So it's our tracking purposes for all of the patients and all of that stuff. So the temperature stuff and all of that is in compliance with VFC. But my question is because we load individual syringes, we don't usually keep the original boxes that they come in. And I was told, if we have any wastage or expired forms or expired vaccines, that we have to return them in the original box or they will not be accepted. Is that true? And if so, what should we do with the doses after if we can't mail them back?
So that is true. You need to keep those boxes because if you do have to transfer them to another facility, let's say, or like you mentioned, when you're returning expired vaccine. So for our AccuVax providers, they keep the boxes until they're expired.
Okay, thank you for that. Because I just took over in our role and the previous person here was not saving those boxes. So if I have that situation and we don't have those boxes, how should I dispose of those vaccines?
I haven't had that issue, but Marcelina, can you jump in?
I'll go ahead and reach out to the CDC. Can you drop in your contact information for me? And then, because I did have somebody who we had to dispose of some vaccines before, and they just, they were compromised to a degree where they couldn't be sent back either. So we ended up having to put them in the Sharps container. So
yeah, that's what we were told by our VFC rep, and I believe her supervisor, she had said that, but I just wanted to make sure that we are, in compliance with best practice.
Absolutely. Let me go ahead and reach out to the CDC in regards to your specific question, and then I will get back to you.
Okay.
And then Tappy, do you guys have a question answer where we can drop off information just so that everybody's aware?
Oh yeah, we can get everything out and put on our website. Absolutely.
I love it.
Thank you. I put it in with my, I put my email in the chat.
Okay, thank you so much, Talia.
Thank you.
Thanks, Marcelina. Any other questions about
do we have to return expired COVID vaccines received from VFC?
So you have to complete the wasted expired return form, but you don't return it back to the manufacturer. We give you instructions that you have to dispose of them in your hazard bin. But providers are still required to complete the wasted expired return form.
All right.
I will go ahead and put within the chat our, it's a link to our slide deck for COVID vaccine providers. And if you just click on Control F and look up wastage, it'll tell you specifically what you're supposed to do along with the wastage form that you need to complete. So I'll drop that in a few minutes.
That's helpful. And we'll make sure for anybody who I can't ever figure out how to get PDFs off of a Zoom box. So if you are like me, we will put it on the website and be sure to email you all the right links. And I think there was one more question just to confirm about, so we were informed to inform IPO and every vaccine manufacturer. So I think this is if there's an excursion. Is that accurate?
That is accurate. Yes, ma'am.
That's accurate. All righty.
Okay.
And lots of people talking about AccuVax, which is cool.
AccuVax is I'm sorry.
Can we use COVID, Pfizer, bivalent 12 plus vaccines 10 weeks after defrost? We can look that up. We'll put that in there, Lucas. Jen, will you look that up, Jenny?
Yep, looking it up now.
Okay, thanks.
Thank you. I appreciate that.
I just dropped the link for the slide deck for COVID. And that is updated every time we do something new. So bookmark that, it's very important.
Thank you.
All right, we'll go ahead and move forward. So we talked about the eligibility and the categories, billing and administration fees. Next is the required vaccine documentation. The provider is responsible to ensure that they're recording the vaccine info from the box, which is the type, manufacturer, lot number, expiration date, the date of the vaccine administration, the date the VIS is given to the parent or guardian at each visit, the date the VIS is published, the administration site, the administration route, and the title, the name and title of person who's administering the vaccine. Name and address of the clinic where vaccines were administered must be on the document as well. And this must be recorded at every single visit. So each dose, each time you have a poke. Providers are required to have the most up-to-date VISs on hand. Immunize.org has a list of up-to-date translations and a section on how to use VISs. VISs can also be downloaded from the CDC directly. VISs must be presented to the patient or parent in any format, on an iPad, a rolling TV screen, paper, laminated. However, if the parent or patient requests a paper copy, providers are required to provide them with one. Immunize.org allows users to subscribe to email updates. We highly recommend that all applicable medical staff subscribe to receive updates, which will include important ASIIS recommended changes and updated VISs. Next, we're going to talk about wastage. The only time doses should be removed from ASIIS. All wastage is subject to the dose for dose replacement policy and counts towards the site's 5% allowable wastage. And what we consider wastage is the common causes of vaccine wastage is broken, dropped, or spilled vaccine, expired vaccine, drawn up but not used, damage in transit, lost and unaccounted for, which is if you exhausted all of your resources to find those doses, that's when you can select lost and unaccounted, but just remember it goes towards your 5%. I do want to let providers know that flu and COVID at this moment do not go towards your 5% wastage. If you do exceed that 5%, providers have the dose for dose replacement policy. As a VFC provider, you have agreed to account for every VFC dose that you have received. Dose for dose replacement is required from VFC providers when vaccine wastage of doses that expire in the calendar year is greater than 5% of the total number of VFC vaccines that expire in the calendar year. Once 5% is exceeded, all wasted doses will need to be replaced. To complete the dose for dose replacement, your site receives a dose for dose replacement form with all wasted vaccine presentations and amounts listed. Your site will purchase private doses with provider funds to replace the VFC doses. Your site will fill out dose for dose replacement form with the information for the private vaccines and submit the signed and complete form with all relevant packing slips. These private doses will be converted to VFC doses in ASIIS, and your site will administer them to VFC eligibility patients only. In situations where providers fail to maintain vaccines per VFC program requirements, immediate dose for dose replacement may be required. Once again, wastage includes all expired doses, drawn up, not used, unaccounted doses, doses not appropriately attached to the patient records in ASIIS and decremented from the ASIIS inventory, lost and unaccounted, broken, dropped, spilled doses. For further information on the policy, please refer to the Arizona VFC Operations Guide. VFC records must be maintained for 6 years. That includes all eligibility, screening, and patient medical records verifying their vaccination, all billing records, all temperature logs and data logger reports, all vaccine inventory, ordering, and accountability records, and all all vaccine adverse event reporting VAERS forms.
Can you talk, Roseanne, about how the process works for them when they get those, like the report cards? Because Lorraine is asking, how often do we receive the bill?
So you receive first of all, you receive your report card on a quarterly basis. Once the year is over, so for example, you want to ensure that you're accounting for all doses for 2022. If you do exceed that 5% in the beginning of the year, we will notify the provider and let them know that if they have exceeded the 5% and what presentations they have to replace. Now, I do want to let the providers know that you have to replace all wastage. So it's not like if you were over 5 by 2%, you have to replace 2%. No, you have to replace everything.
I also wanted to go back. I know somebody was asking about the COVID bivalent boosters. Just to be clear, Pfizer is the one that can be refrigerated 10 weeks. But for the Moderna bivalent, that's 30 days within the refrigerator when it's not punctured, just to make sure that we're all on the same page. There's a lot of stuff out there. I know that there's probably about 10 or 20 of them now.
And then Jen's asking about any leniency due to COVID, decreased in-person visits, et cetera, for wastage. So the wastage do expired doses fit into this?
It's all expired, and that's why we tell our providers order small but frequently to avoid wastage. But as far as for COVID, that's going to be up, that will be leadership's decision if they want to be lenient on it, but I haven't heard anything. I don't know if Marcelina has heard anything.
Yeah, so for, again, COVID and flu does not go towards your 5% wastage for VFC. Now, we have not, because of COVID, we know that everybody's been hitting boots, ground running. You guys are pulled in many directions. So for the last, I believe, 2 years, because of COVID, we have not been coming back for wastage currently. I've not heard anything from leadership as far as if we will be doing that this year. If we're going to be doing the replacement policy, it is a good thought to always keep that in the back of your head that you could potentially be responsible for paying those doses back. At the end of the year, there is also, let's say that you had an unforeseen storm that came in and it just knocked everything out, knocked out power lines. There is a form that you can fill out at the end of the year that you could explain why you don't feel that you should be responsible for replacing those doses. And we do take that on a case-by-case scenario.
And the report cards are on the doses that expired those months, not the doses that were necessarily administered those months, right?
Well, it does show you that the report card, again, it's sent out quarterly and it's all, it will include all the doses you ordered for that year. So for example, for 2022, you'll have all the presentations that you ordered that are going to expire in 2022. And it does show a column of the doses that you have linked properly to a patient, and then wasted, which means you filled out a wasted expired form. And then there's an unaccounted, which for us, we're thinking those doses are in your unit. So that's what how the report card is sent out.
In regards to Jen Nunes, if you have just one provider that you're working with, if you need an updated list, we can provide you with an updated list of providers that are near you that you can reach out to. And then you can also reach out to the county. Usually the counties will sometimes take those vaccines. So if you need an updated list, just go ahead and send an email to help desk and they'll get one for you. Okay. Great.
Anybody else have questions on this, on the dose for dose accountability policy report cards? I'm sure we'll have questions coming up in the next few years because it has been a little bit of back of mind, I think, for folks the last few years as you've been focused on other stuff. So thank you for answering all those, Roseanne and Marcelina.
Sure, thank you. Last slide, and I just want to let all our providers know we have lots of training. we have our dose accountability webinar, which you can register by clicking on the flyer on the ASIIS homepage. If you have the VFC 400 log tags and you need some further assistance in it, or just to learn how to like fix the alarms or something, we do have the training PowerPoint on our azdhs.gov/VFC under the VFC Operations Guide and Resources. And once again, APO Train is the Arizona VFC Learning Management System, which you can sign up for trainings, and we have lots of resources. And now we've incorporated COVID into it, so you can take the trainings for all that to ensure that you are in compliance.
Yes, Paula, there is training for VOMs in there as well. We also have, and I will place the link in there, that goes to our direct resource page and our operations guide, but there is one called VOMs 2.0, has everything for the training guides for VOMs 2.0 as well there. And then also this coming year, we will be having our first, well, I think we skipped it the last couple of years, but we do have our VFC annual conference that is going to be also coming up in April this coming year. So that's exciting to being able to see you guys and network as well. Yes, yay. I know, I'm really excited about it as well. So you'll see some more announcements as we get closer to that time frame. So we are going to be excited to see you all there. Thank you.
Yeah, and I also have Lonnie on the line. And so if you have any questions regarding VOMs, he's so kindly said he can assist. I know we only have a little bit of time, but he is our go-to person, so he's super experienced on it. So if you have any questions regarding VOMs, right now is the time to ask.
And I just dropped the link, everybody, to the resource page for our operations guide, as well as required forms, everything about our incident reports. That is a good resource page for you to bookmark. It is constantly being updated with our latest information.
And that concludes our training. Does anyone have any questions or concerns regarding anything regarding the VFC program?
Can you, oh, Jen's waving. So Jen, if you want to unmute yourself while you figure out how to do that, can you just confirm if they have an excursion when IPO office is closed, what do they do? How do they notify you and when?
So they can isolate the vaccines in the unit, put the do not use sign, and then in the morning they can notify us, or they can contact the manufacturer. So regardless, they need to contact us if they're going to do it themselves, or have us take or complete complete the viability of vaccines.
So no matter what, IPO has to be notified, and
Yes.
if it happens overnight, you call Merck or GSK or whoever, and then call IPO in the morning. Make sure IPO knows in the morning.
Yeah.
Yeah. And go ahead, Roseanne.
Oh, sorry. I was trying to find, sorry, I don't mean to go that fast. So like I said, if you're going to contact the manufacturer directly, we do have the temperature incident instructions on the what is it, AZVFC / I'm so sorry, I should know this by heart, but I don't. But you will see the instructions where it says temperature incident instructions. You'll click on it and complete the red cap survey and upload all those documents. But as long as you get the thumbs up from the manufacturers, you can resume using them, even though you reported it to us. So you don't have to wait on us to tell you, oh, go ahead and, you're good to go. So
Yeah,
that's a good
very
thing about
welcome
it.
change.
Yeah.
I went ahead and dropped those incident instructions there for you if you want to contact the manufacturers yourself. Now, just to reiterate, this is if, like, let's say you went home, you came back, you're looking at your min and max, and you notice, hey, my vaccine was out of range. Then you're going to contact us that day. If it's where, let's say it's 5:01, you're about to walk out the door and you notice that your unit is going out of range, implement your emergency vaccine plan so that you can try to salvage those vaccines, especially if you have power outage, something where you know that those vaccines may not be viable. You can transport those vaccines, transport it with your data logger to make sure that they're constantly being monitored. And then once the next day, you can contact us for more information as to what your next steps are going to be. But if at any point you're able to transport those vaccines, because you know those units are not going to be back up and running, or there is a default in one of your units, definitely transport those vaccines so that we can save them.
All right, Jen, what do you have?
Okay, sorry, I have lots of questions today.
Good.
Just for clarification, so the report card Roseanne had mentioned, it shows off of what you've ordered for that year. Does that include flu and COVID orders?
No,
Initially,
you won't see that there. You're only going to see the regular
just
VFC
the
ASIIS.
routine vaccines.
Exactly. Yes, ma'am.
Perfect, okay. Thank you.
You're welcome. Any other questions I can address?
Anybody else have stuff? All right, well, thank you both so much. And we always push all of ADHS's trainings too. So we'll make sure that you all get notified about those trainings as well. This is our last tips training for 2022. It's been one heck of a year. We've really appreciated everything that you've done. We do have a training in December called 10 Things Parents Need to Know About Why We Immunize. This is a training that we do quarterly. It's really great if you have any new medical assistants, front office staff, billers and coders, like anyone in your office that might not be working with vaccines every day, but is asked questions from your patients and from other folks. Social workers, community health workers that you're working with, any of those folks. So, and you too, because we all like to know how to better talk about vaccines. And then we know it's the choir and we're going to preach to you anyway. Get your COVID booster now. If you haven't already, get your flu shot now. Tell everyone you know to do the same. Remember to wear masks when we're in crowded spaces, when we're traveling. Cover your coughs and your sneezes, wash your hands again, keep washing your hands, and try to crack windows as much as you can to keep ventilation going. If you're not in Flagstaff, it's a little bit easier to do this time of year, or somewhere where it's cold and snowy, and most importantly, stay home when you're sick. This is not going to be a quick and easy flu season. As you've already seen, it's not going to be a quick and easy RSV season. We really need you healthy and in your offices. And we need your kids to not get sick and all of those things. So thank you all so much for everything you do. We are going to send you a schedule. Sorry, I didn't wear my mask apparently, where I should have been, I guess. We're going to send you a schedule about what we're doing next year for tips. We are really hopeful to continue doing trainings with all of you throughout the year and hopefully seeing you in person next year. So stay tuned for more information about that. And have a great end of the year. And as always, let us know how we can help you all. And we'll keep it open for a few minutes in case there's questions, but otherwise we'll log off if you need to. Lots of thanks and holiday wishes. We love those.
I have a question.
Yeah.
So when we're going to order the primary doses for the COVID vaccine, the quantities are still really high. Is there a time, or do we know if we're going to be lowering those order quantities?
Marcelina, do you know that, or should I find that link?
So
Because I know there was a change this week too.
give me 1 second.
Okay.
Because I know that we are now offering the bivalent where it's 50 doses. I think that is coming down the pike. I can look really quick, but I believe that they're going to be switching over to the primary series to be the bivalent versus the monovalent. So give me 1 moment. I'm going to just kind of confer with some CDC representatives really quick and come back with an answer for you.
And it's Jen, I think I heard too that the monovalent was going from like 300 minimum doses to 150 soon.
Yeah, give me 1 second. Let me reach out to one of my people.
Thanks.
Rebecca, while she's looking that up, just to clarify what I believe I heard is that the bivalent is soon to be able to be used for the primary dose. That's
Yeah,
what
we'll find out when, as soon as that change happens, if it happens, we'll make sure to blast it out. And it'll come out through your ASIIS portal and through CDC. Like everybody will let you know when that happens, if it happens. When do you expect that, Jen? When are they meeting next? Do you know?
I have not seen the date, but I think I think it's soon, before the end of the year, maybe. But until we get the final, the official notice, it's still the monovalent.
Yeah.
Right. Thank you.
Are you getting primary series, like new people starting their series still?
Well, we're a rural community, and we have to have it on hand if or when it's needed, because we don't want to have to turn that patient away. But it's trickling. It's not a steady number, and that's why I'm saying 300 doses to order. It's a lot of wastage.
Right. Yeah, and even I know this has been like really challenging throughout the pandemic, even though we know it's not on the report cards and you're not going to get bills, like it's separate. It's really hard. We've trained providers for so many years to not waste vaccines for so many different reasons, like there's always shortages and things. It's really hard to get that out of your head, that you're like don't waste an arm instead of don't waste a dose. Mentality has been really hard.
Right.
Huge culture shift, Oh, okay. Marcelina's saying, did you want to unmute and say anything else?
Sure, absolutely. So the Pfizer monovalent is going to be going down from 300 doses to 180 doses per order. That's going to be coming available first week of December.
Cool.
Okay. Thank you.
And then there's always that vaccine matchmaker.
I was going to say,
too.
yes, thank you for mentioning that. We do have the matchmaker. So at any point in time, you could also reach out to providers near you that are part of the COVID program and say, hey, we're going to order some vaccines. Do you need vaccines? Do you need vaccines? And then kind of do transfers that way, so that we are not, we're just ordering what we can use. So definitely use Matchmaker if you're looking for something less than what we offer on ASIIS. And I will drop the link for Matchmaker. Oh, somebody already did. Thank you, Jennifer. Yeah. Oh, and Rebecca, you guys are on top of it. Thank you.
Okay,
yeah, that might be hard for you in rural Arizona to find somebody with extra doses.
Yeah, thank you. I appreciate that help.
Yeah, if you're in a rural area, Paula, are you close to a county health department at all?
No.
Oh,
So we're part of Pinal County, Pima County, and we're not really close. It's about an 1.5 to 2 hour drive.
Got it.
Any other questions? All right, well, happy Thanksgiving, happy holidays to everybody, and we will see you next year. And will say goodbye to 2022 just as eagerly as you all do. So we'll see you next year. Bye-bye.